Today, something to smile about comes from Isaiah 41:10, and it reads, "So do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand." Now that's something to smile about. Hi everybody, welcome to the RDH Encore channel. I know that things look a little different. I'm actually in my car driving, running a few errands on a Saturday morning. I kind of wanted to do something a little different today. I had an idea for a video and I just wanted to just do it. I know that the quality of this video may not be great because it's not filmed on my DSLR. It's just simply filmed on my phone because that's what I had available to me right now. But I kind of wanted to talk about some of the things that patients say that they just shouldn't say. People may agree or disagree with this, but I don't know, I kind of had one of those weeks where it didn't upset my whole week or anything like that, but I did just start at this new company, and you know, anytime that you are seeing new patients, whether it's on a temp or a permanent basis, sometimes they are a little reluctant to see a new hygienist because they're used to who they're used to, and I completely understand that. After 7 years of practicing, I definitely get that, being in different situations. I mean, I get to the point where I'm used to seeing a certain person, but also having been in that situation, I am still very open to it because, I mean, everyone has to be new at some point, whether you're new at practicing dental hygiene or you're new at, you know, that particular office or with that company. Everyone has a first day, a first week, a first month, that kind of thing, where they're getting acclimated and all of that kind of thing. So anyway, the video is really not about that. I really want to talk about some of the things. It was a trend this week where, you know, patients would say certain things and I'm just like, why did you say that? Like, it just, you know, it just kind of furthermore makes the situation kind of annoying and just uncomfortable, that kind of thing. And so, I mean, if you're not interested in this type of video, it's kind of a rant, I'm not even gonna lie to you, then feel free to, you know, join me for my next video. Probably get back to normal there. But there are a few things that patients just said to me this week that just kind of annoyed me. And usually my videos are catered to patients and patient education, but it's also sometimes catered to fellow hygienists and people who are like prospective hygienists or people that are in hygiene school, just to kind of show you how day-to-day is. You know, it's, you know, we're there to provide patient care, and that's great. That's the goal of it, you know, but sometimes there are those annoying things that come with the territory, but that's with any profession. So if you're interested in my little rants, then please stay tuned. The first thing that patients, you know, sometimes say that they probably shouldn't is, do you have to press down so hard? So I got this question from a patient this week, which was kind of weird because I was pretty much already done with my procedure of, or my assessment of probing their teeth. Now, normally I introduce my probe, especially if I'm probing someone for the first time. I will let them know that this is an instrument that I use to take measurements of your gums, and the instrument tip is very blunt, but it can feel sharp in the areas where there's some inflammation present because of hypersensitivity. And so sometimes I'll even test it like on their hand to show them that, okay, this is very blunt, and they can feel this is blunt, but, you know, and they can tell in those areas where they need to work on. So anyway, honestly, I didn't do that in this situation because this patient had been probed so many times before. So anyway, that's my bad. I probably should do it for everyone. So anyway, I probed. I was pretty much already done. I was on the bottom, started on the top, got on the bottom arch. And then he was like, do you have to press down so hard? And I was like, sorry, got a little distracted there. So I told him, I went back and gave my little disclaimer about the whole thing about it feeling sharp and all that kind of thing. And I told him I apologize. I should have introduced that instrument to him before. And the reason that I didn't was because I saw that he had been probed, plenty of times before. And so anyway, I told him I apologize, if it's uncomfortable for him. There are some areas of inflammation that may, seem a little uncomfortable because of the hypersensitivity. And so kind of backtracked a little bit or whatever and explained it to him, and did apologize that he was feeling some discomfort. I offered to put some numbing gel and all that kind of thing down for him, and he said that was okay, don't worry about it, and he understood. So whenever I finished probing his teeth, I went in and like with every patient, I go in and I show their probe chart to them. I show them which areas that they, could afford to work on, the areas that are having some issues and the areas that they're doing well in, what they can do to improve those areas. And so I did that and we got to the point of he understood which areas. Okay, and I was like, is there something that you're maybe doing a little different? Because I showed him the probe chart from before where the previous hygienist had probed him, and that he didn't really have very many issues. He did have some areas of inflammation, but not nearly as many as he did then, and so that would explain why things are a little bit more uncomfortable. So anyway, I went in and explained it to him, which this isn't abnormal. This type of thing happens all the time, but he had such a big issue with me probing and it didn't feel good, but I didn't even notice it in his face or anything like that until we got towards the end. Then I offered him numbing gel. He didn't take it, that kind of thing. And so I just didn't want him to have a bad experience. And so anyway, he said that that he was slacking on his home care because he had been sick or had a cold or whatever the case may be. And so we agreed that, okay, you should probably focus on these areas. This is what you can do and things will improve for next time. That was it. So it's just one of those things that it's kind of annoying to me because, people say things in certain ways like, do you have to do that? Like, yeah, this translation to me is that, yeah, this is my job. I have to do it, and the thing about it is that with probing, if I'm taking measurements of your gums, like 1 millimeter can make a huge difference. Like 3 millimeter versus 4 millimeter is the difference between normal gums and gums with gingivitis. 4 millimeters versus 5 millimeters is the difference between gingivitis and periodontal disease. Of course, we're taking x-rays into consideration and all that kind of thing, but in order to get accurate probings, I have to press down a certain amount. I'm not stabbing him or anything like that, but it's like, just translation to me in my head and probably to many of my other fellow hygienists would be, I have to do my job the way that I was trained to do it, and it's just kind of like someone telling you how to do your job. I understand if you're uncomfortable, please let me know. And that's why I offered the numbing gel at the first notice, of him being uncomfortable. But usually there's other cues there, there's other cues to where a patient is like, flinching a little bit and things like that. And of course, at that point, ask them if they're uncomfortable and do what you can to make them more comfortable. But there was no indication of that. And honestly, this patient just kind of came in with a weird attitude anyway. So it's okay, But that was one of the things that just kind of came at me this weekend. I was just like, dude, you really didn't have to say that. The other thing that I was presented with this week was someone asked I guess I was about to begin, cleaning their teeth or probing or whatever the case may be. And I opened my bag, my bag of instruments or my pouch of instruments. And they said before I put it in their mouth, they're like, is that sterilized or is that clean? I'm like, yes. I wouldn't dare put something in your mouth that's not sterilized. That's compromising my license, and it's also just not right as a human being to do that to someone. I mean, we deal with blood and all other types of bodily fluids that could, have serious infection, and transmitting that's serious. So no, I would never take that lightly for anyone. But the thing about it is that just kind of makes me feel like translation to a hygienist or to me personally says that I have, like, basically you don't think that I'm ethical and that I have no regard for human life or health. Like, it just, that just kind of, that was annoying to say the least. And so that's one of the things that patients probably should not say to a hygienist. You know, if they have a question about as to whether something's sterile, then, you know, maybe ask them if, tell them that they're interested in seeing, they saw on the news, you know, how we sterilize things, and they're interested in seeing, you know, what the package looks like, or whatever the case may be, something like that, just to make it seem a little bit more tactful. That shows me that you don't think that I am just a gross person like that and just unethical. So I mean, I would respect someone if they just asked me to see the bag. Anyway, yeah, I would respect that a little bit more, but it just kind of messes with the whole vibe of the rest of the appointment whenever I feel like you're accusing me of being a horrible hygienist. Not really horrible, but kind of being a bad hygienist and not being ethical and not caring about your health. That's what I'm here for. That's exactly what I'm here for. So anyway, that was a little frustrating and annoying. So that was just another thing that patients should probably not say that to their hygienist. Okay, so the last thing that I was kind of presented with this week that was very annoying to me. I know I told y'all this is going to be a rant. This probably sounds very negative, but I feel like sometimes you just have to get it out. You know, these are things that different hygienists are presented with all the time, and so I'm just going to speak on it today. Now, this last one was something that a patient said to me this week, and oh my goodness, I think this probably annoyed me more than any of them. So she came in, hadn't been in for about a year or so, and this is my first time seeing her, of course, because I'm at a new office. And at that point, I was about to start, I was like, okay, we're going to polish your teeth now. And, I normally tell the patient what I'm going to do before I do it, that kind of thing, just to kind of keep them up on what we're doing and to put those people at ease that kind of are a little nervous about getting their teeth cleaned or being in the dental chair. And so I think I told her I was about to polish, and she was like, oh, did you get it all off? Yes, I got it all off. And so I don't know, it was just kind of hard for me to fix my face, and because translation to a hygienist in my position would be basically, you thinking that I'm not doing my job, or again, being unethical and just kind of neglecting you and not doing what I'm supposed to do to the best of my ability. Like, why would I go ahead and polish your teeth if I didn't get it all off? Why would I partly clean your teeth? I don't know. Anyway, very, very annoying to me, and it just kind of basically made me feel like she came in there telling me how to do my job, and I don't care what type of situation I'm in. It could be the most annoying situation ever. It could be to where a patient's just completely rude. I'm going to clean your teeth to the best of my ability, because that's what I am here for. I'm here to serve you in that manner. The other thing is, like, if a patient has an issue and they can't open their mouth all the way, or they can't be put all the way back, and I just have to struggle and strain my back, I'm still going to do the best that I can to clean your teeth. And that annoys me, because it was just unnecessary. That's yet another thing that a patient should not say to their hygienist. Don't say that. Anyway, so, I mean, I can understand these patients. I can understand it from their perspective, but I just feel like there's another tactful way to kind of say it. She could have said something like, I know that I had a lot of buildup and I haven't been in for a while. Were you able to get most of it off? That kind of thing. I would have respected that, I would have respected that. But anyway, yet again, like I said, a rant. And yeah, so that was my week. But that wasn't the full week. Don't get me wrong, I had a great week, but these were just some of the annoying things. And it was kind of a trend that there was just way more annoying things that were said by patients this week. And so I just felt the need to share with you all. So anyway, I really hope you don't feel like this was too much of a rant and just negative, but hey, I guess it's my channel. I had to let it out, and I need to show you the good, the bad, the ugly of dental hygiene, whatever the case may be. Everyone has the negative parts of their profession, and that just happened to shine this week in my life. Anyway, so that's all that I have for today. If you like this video, please hit the like button. Also, feel free to leave me a comment down below if you are a fellow hygienist, or you're a person in school trying to become a hygienist right now. Please leave a comment down below and let me know if there's anything that you've ran into with patient care and dealing with patients, things that they have maybe said to you that's probably not something that they should have said. I can imagine that, you know, those that are in dental hygiene school probably have some kind of crazy stories or things that patients have said to them because they're new. Even though they went to like a hygiene school to get their teeth clean or know that they're dealing with, you know, newbies, that there's probably some things that they have said to them that probably wasn't the best thing for them to say. So I'm interested in seeing what you all have to say. Please understand that I'm not trying to be negative by putting this video out, but there are things that you just have to let it out sometimes, and I'm a believer in that. But I'm going to move on and continue to do my job to the best of my ability because I really love my job. I love my patients that I see, but I do understand that sometimes there's a transition period to where you start working at a new job or just, you know, start dealing with new people, and, you know, everyone's personalities and, you know, it didn't mesh all the time, and that's completely fine. Maybe we'll find common ground at some point, and you know, those patients did not leave just dissatisfied or anything like that, and that's the goal for me. You know, I want to make sure that I do my best and that they didn't leave, you know, not satisfied, and you know, everything's just a positive situation for the most part. Even if I felt offended inside, I kept it inside, but it's out on this video now. So anyway, like I said, please like this video, please comment down below, and then also if you're not currently a part of the RDH Encore family, please feel free to hit the subscribe button and also hit the bell so that you can be notified whenever I post new videos like this or any of my normal videos. Also you can let me know what you feel about this whole driving in the car situation, just random video type thing. I know I haven't been able to put very many videos out lately, but I really do miss doing things, but sometimes I'm just not able to sit in front of my camera and do what I need to do. I'm just not. I'll get my life together at some point. So anyway, that's all that I have for today. So until next time, everyone take care and remember to let your smile shine. Bye.